Doxepin capsules is used to treat mental mood problems such as depression and anxiety. It may help improve mood and feelings of well-being, relieve anxiety and tension, help you sleep better, and increase your energy level. This medication belongs to a class of medications called tricyclic antidepressants. It works by affecting the balance of certain natural chemicals, neurotransmitters in the brain. How to use? You can take Doxepin before or after meals. Many people find it helps to swallow the capsule with a drink of water. For all dosage forms, capsules are a solution for depression or anxiety. Adults and children 12 years of age and older. At first 75 mg once a day or in divided doses during the day. Your doctor may adjust your dose as needed. However, the dose is usually not more than 150 mg per day. Children younger than 12 years of age, use is not recommended. For all dosage form tablets, for insomnia, adults 6 mg once a day. Older adults at first 3 mg once a day. Your doctor may adjust your dose as needed. Children, use of dose must be determined by a doctor. Contraindications. You should not use Doxepin capsules or liquid if you are allergic to Doxepin or similar medicines such as amoxicillin or loxapine, or if you have glaucoma or urination problems. Do not use Doxepin if you have used an monoamine oxidase inhibitor in the past 14 days. A dangerous drug interaction could occur. Monoamine oxidase inhibitor include isacarboxazid, linezolid, methanol blue injection, phenelzine, rosigaline, salicylic, tranylsapramine, and others. Tell doctor if you have used an SSRI antidepressant in the past 5 weeks, such as citalopram, fluoxetine, fluvoxamine, paroxetine, sertraline, trazodone, or vilazodone. Tell doctor if you have ever had bipolar disorder, manic depression. Some young people have thoughts about suicide when first taking an antidepressant. Your doctor should check your progress at regular visits. Your family or other caregivers should also be alert to changes in your motor symptoms. Tell a doctor if you are pregnant or breastfeeding. Doxepin is not approved for use by anyone younger than 12 years old. Warnings. You should not take Doxepin if you have glaucoma or problems with urination. Some young people have thoughts about suicide when first taking antidepressant. Stay alert to changes in your motor symptoms. Report any new or worsening symptoms to a doctor. Do not drink alcohol. Dangerous side effects or death could occur. If you're driving or has this activity, I tell now how Doxepin will affect you. Your reactions could be impaired. Doxepin side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficulty breathing, swelling of a face, lips, tongue, or throat. Report any new or worsening symptoms to a doctor such as motor behavior changes, anxiety, panic attack, trouble sleeping, or if you feel impulsive, irritable, agitated, hostile, aggressive, restless, hyperactive, mentally or physically, more depressed, or have thoughts about suicide or hurting yourself. Doxepin may cause serious side effects. Call doctor at once if you have blurred vision, tunnel vision, eye pain or swelling, seeing halos around lights, a lightheaded feeling like you might pass out, tremors, restless muscle movements in your eyes, tongue, jaw, or neck, severe constipation, confusion, hallucinations, unusual thoughts, seizure, convulsions, or painful or difficult urination. Common side effects of Doxepin may include drowsiness, dizziness, increased blood pressure, vision changes, rash, swelling, nausea, vomiting, indigestion, little or no urination, dry mouth, constipation, or decreased or increased sex drive.